I'm very honored to present you our newly guidelines in mild and moderate hyperthermia treatment. It's a first publication that we could collect with the different levels of publications. So we had a consensus meeting. It's 14, 15 years ago. It was published 2008. The part of the consensus was the total body hyperthermia. And so we try to develop and find a new consensus about this hyperthermia forms in total body. So the general consensus, then what we need is guidelines to integrate this total body in treatment of oncological and non-oncological disease, including indication, contraindication, and side effects. For this quality levels, we need, of course, process quality, results, and safety. The whole body hyperthermia generally means that we are able to increase the core temperature of the body in different level. That was a huge problem to define the right parts of total body hyperthermia. So we have, in this case, in the guidelines, two different parts or options. One is called mild body hyperthermia with a core temperature up to 38 centigrades with continuously temperature measurement, and in this case short duration hyperthermia for most cases in non-oncological disease, for example pain patients, or fibromyalgia, and second option is longer than the 30 minutes. In moderate part, it is mostly treated in the most clinic in Germany is between 38 and 40 centigrades. So this is also in two parts. One is up to 3 hours, and second option in most cancer treatment in combination is up to 4, 5, 6 hours. This is a summary of the forms of different hyperthermia forms of total body, and with time scheduling, with core temperature, indications, and patient monitoring up to intensive care, and the indications for the treatment for different core temperatures. In this case, from 38 to 40 centigrade, mostly in common chronic disease and in oncological part. The temperature controlling is one of the most important issues that we have to do, and during the treatment, the vital parameters must be documented continuously. So it is necessary to have a quality of the treatment. 90% or higher, the core temperature can be measured, of course, very easy in rectum if it's not possible. So other locations is also possible, but we have to know that there can be a difference between surface temperature and rectal or core temperature from up to 1 centigrade difference. So this must be done. The mostly indications for mild or moderate total body hyperthermia is in stage 4 patients. It means in one hand, we have very aggressive or chemoradiotherapy resistance cancers entities, or it is in third or fourth line treatment without any realistic success of the treatment. This is a typical indication for the combination in radiotherapy or chemo drugs. In most cases, recurrence or metastatic situation, and in the past 2 years, also some experiences with diffuse bone metastatic disease. So what you present just now. In the past time, is also existing very small studies with only few patients. It was renal cancer, preoperatively whole body hyperthermia up to 4 sessions, and post-surgery repeat again with 2-3 total body hyperthermia, and in the 5 years later in the group with total body hyperthermia of favor was more success than in a control group. This is a part of non-oncological indication where it can be used, the total body hyperthermia, with different time scheduling, different temperatures, and they are existing in randomized study, for example, with fibromyalgia, chronic pain, and major depression, also in immune deficiencies and chronic inflammation. This is also one possible indications for non-oncological or chronic disease. This was from 2012 with the quite good results. It was a randomized controlled study. This will be updated in the next time. Of course, every treatment has its own contraindication and depends from the core temperature and time. We have different contraindications. It must be done from medical trained staff. These are the typical available and used device mostly here in Germany and other countries. What is necessary? Of course, training of medical staff and information of patients, how to treat the patient, make the right choice, and controlling for patient safety, as in every case in chemo treatment or in radiation therapy. This is sure very important and not to discuss. The aim of the guidelines is that we have had up to 2 years ago no real handbooks how to handle, and this is a newly developed option that our colleagues can treat the patient in the similarly or same way for different indications. This is a first guideline. It means it's under developing every time, and if we have newly sciences, new studies, so it will be adapted, I think so, every second or third year, that we can increase the level of the indications and studies. In conclusion, the quality control is very important. Therefore, it's necessary that we have training, teaching, and certificated centers who want to treat the patient with mild or moderate total body hyperthermia. Proof of indication, if it's possible, it's very important, like in our radiation clinic, that we present our patient in a tumor board and have a consensus for indication of hyperthermia, local hyperthermia, total body hyperthermia, and the combination. but in clinical practice, I know that mostly colleagues are working alone, and outside it's not all time option to discuss in tumor board. And very important, of course, have care of your patients, and just with this guideline, we have something with poor level, but in some cases level 2 or 3, it's also available. And it seems so that we have possibility to increase the level. This is a booklet. It's outside. So this was part of my lecture, and I'm glad to invite you to the next Hyperthermia Congress. It will be on 20 and 21st September in Berlin. You are invited. Please come and visit us. We need your knowledge and presentation. Thanks a lot for many colleagues who was invited in this guidelines. Thank you very much.
Okay. Do you have questions?
I have a question. So you showed us a lot of indications from the oncological field and non-oncological field. And what is the rationale to use mild compared to moderate hyperthermia in these different diagnoses? Yeah. So you showed guidelines, but what is the rationale to have higher temperatures, and what are the indications for lower temperatures?
Regularly, the mild whole body hyperthermia is used in most cases in chronic disease, not oncological disease. But some of the patients have, for example, diffuse pain situation, and for pain reduction is mild body hyperthermia, and it depends from the patient condition. Karnofsky index, it is not possible to prolong the treatment time, and in most cases it seems so it's not necessary to have a long time in chronic disease or pain patients. But the moderate, it means long duration favor range hyperthermia is in cancer patient, and depends, the time scheduling is depending from the chemo drug, what the patient get. So in some cases it's necessary to give the chemo drug on top of the temperature, and some cases, like what was described from Ripowski and John Bull, to do the total body hyperthermia 1 or 2 days later. That's the rationale.
Thank you very much for a presentation. I wonder, are these guidelines published, and are they available?
Yes.
And can we get a reference? Or?
Yes, of course.
Okay.
It was at first in German language, and it's translated in English, so it's available in both languages. If you want, you can send us a mail. We can send it digital, or it's available on front of the hyperthermia dishes outside.
Dr. Sahinbas, thank you very much for your brilliant report. My question, we know that the concept of moderate and mild hyperthermia was introduced by von Arden in the 80s and was extensively studied, for example, in Texas for many years. And up to date, as we see, we have only pilot trials. Is it not suspicious to you?
The hyperthermia have a general huge problem in Pasai. We are just now on the way 30, 40 years, and we couldn't finish really randomized international studies. It has different reasons. So, but up to now we have no manuals how to handle. And this guidelines, it's only manual for our colleagues, who started new or who try to make the treatment on the patient, that we have more or less the same level of treatments on this both different hyperthermia.
So the time is
I'm
running.
sorry, but we can discuss outside.
Yeah. This time is running. We come to our last speaker.